So I basically want to talk about today the vaccine hesitancy. I know it's not been like talked about in a while, but I feel like it's still there and it needs to be just like discussed again. On Tuesday, so yesterday, I noticed there was a discussion from federal health officials on basically how they and Fauci, Dr. Fauci, and basically getting more citizens the vaccine, right? They want to influence more citizens to get the vaccine and the boosters and all that. But with that hesitancy from some people still not want to get it, why do you think that is?
I think there are a lot of factors when it comes to vaccine hesitancy. I think that driving force is usually disinformation. And if you go into certain populations, the disinformation can be a whole lot more compared to others. When you look at Black and brown communities, there's a lot of disinformation because where we get our news and our information can be relatively limited, especially, let's say, I'm Puerto Rican and I have a lot of patients that are Spanish speaking only, and they only get their news and their information sometimes from group chats in WhatsApp or Facebook. And those typically don't tend to be the most reliable sources of information because they're not vetted by anyone. So, if your tia calls you and says, oh, I read that this doctor somewhere was silenced because the vaccine is doing these horrible things. And you're like, well, where do you get that information? Who's the doctor? Where is it from? And you try to verify it. You go down the rabbit hole and turns out that it was all fake, but that it's presented to these populations as the reliable news, so they are going to believe it. And then you have the more kind of mainstream stuff of the anti-vaxxer movement, that they have a lot of theories that none of them seem to pan out when put into the light of truth. So it's very challenging addressing vaccine hesitancy, because depending on who you're talking to is the tactic that you're going to have to use. Because again, with certain minority populations, it's relatively simple to go to them and say, well, what have you heard? Let me clarify that for you. And if it's coming from a trusted source, like the doctor they've been going for the past 20 years, or the minister or priest at their church, or a community leader, that helps a lot. Baystate did a lot of that at the very beginning when the vaccine came out, and it did help quite a bit to get the vaccine rolling. But there are certain groups that, you can't reach everyone all the time. So it's always important to do things like this to kind of reach out to people and tell them, there's a lot of misinformation out there. It's important for you to, number one, get accurate information from a reliable source.
Okay, I actually seen that in a study, they're talking about how misinformation is like one of the bigger causes of that. Because it's always changing, like your views going to always change. There's always going to be different perspectives. And so that's why the hesitancy is so major right now.
Yeah.
But another thing too I wanted to bring up, I seen it was in the New York Times, I think. They mentioned how there was 300 Americans still dying from COVID-19. So that's like another skeptical reason to be worried of. So yeah, how does that basically increase someone's hesitancy even more with those constant deaths still there? Like it's not gone away completely.
Well, it is true. We're still seeing a significant number of not just Americans, but people around the world dying from COVID-19. If you look at the CDC's most recent data, I believe it's about 2,600 people dying on a weekly basis from COVID-19 nationwide. People might say, well, oh, you have all these drugs and all these vaccines and people are still dying. But you gotta look at the nitty-gritty details of the information. The people that usually get really sick and end up in the hospital, for the most part, are people that are not vaccinated, or people that have significant medical conditions that even if they got it, even if they have the vaccines, they have a higher chance of getting complications compared to someone that's younger and healthier. The same argument is the argument that we've been making for decades for the flu vaccine. The idea of the flu vaccine is, yes, ideally will prevent you from getting it, but if you get it, you don't get that sick that you end up in the hospital or die. And I think that is where the focus of the COVID vaccine has changed over the past year and a half. That initially is, oh, we can probably prevent infection altogether, perhaps make this go away completely. But as we saw how it mutates and moves through the population, the focus was like, well, the vaccines, their efficacy at preventing infection dropped a bit, but they're still really good at keeping you not getting deathly ill or even dying. So that's the main focus of vaccination, keeping people as healthy as we can, and obviously keeping them from dying. So the numbers are as good as they are simply because we've done all this work and all this vaccination efforts to drop it down to that number. If you go back in the middle of the pandemic when we had tens of thousands of people dying on a single day, compared to 2,600 in a week, that's a great improvement. Could we do better? Of course. If we get everyone vaccinated and on board with the game plan, we can certainly drop that number as close as to zero as we can get it. But just because people still get sick and people still die from it doesn't mean that that's a good excuse to kind of not get the vaccine. It will be the same way that, people still die from car crashes, I'm not going to wear my seatbelt. That doesn't make sense in my mind.
Yeah. So do you think like people should be getting the vaccine then, as in your opinion? Or
Most certainly. I don't think you're going to find an infectious disease doctor that's going to tell you no to that question. Are you still there? Oh, you cut out. Is it you or is it me? You're frozen.
there we
Oh,
go.
there you are.
Back.
There you are. Like, I
So-
was looking for myself for a second there.
Okay, so I was gonna mention, like, some people are still on the offense about it, right? So what if like a person's just like completely against it? And like what would happen, like if a lot of people are just not gonna get it?
That's a tough question because ideally, we are smart enough creatures that if we're presented with information, we change our thinking and our behavior based on those facts. Uh, there's always going to be a group of people that no matter how good the information, how reliable, or who presents it, they're going to dig down in their heels and say no. In those situations, the best that we can do is try to get the people around them protected. So even if that one person is not partaking in the vaccination effort, if you get enough people around them vaccinated, you still get the effect of protecting that person. And some people might use that in an erroneous way to say, well, I didn't get vaccinated and I didn't get it and I was fine. It's like, well, yeah, but everyone in your house, all of your neighbors and all of your community did, so they protected you. So in those cases, there's always going to be that one patient, that one family member, that one friend that is going to say no, no matter what you tell them, what information you present. And at that point, it's you move on to the next person. You don't waste your resources on something that you know is not going to budge. Place your resources in the people that you can still reach out, people that you know that they're getting the wrong information, and you know that if you present them the real information, they're going to change your mind. You focus on those. And you try to get as many of those folks around this one person that didn't agree with you despite the right information to protect that person as well, because whether we want it or not, they're part of our community, and what they do affects us as well.
Okay, now I wanted to bring up too another perspective to this. So a lot of people when they get the vaccine, they regret it. So there's that component too. So if a person's regretted it, how do you think that's going to impact the ones that are still like on the fence about it, like that are deciding?
I think that the first thing I would do is dig down into why are they regretting it. I've had people that say, I regret so much because I got the vaccine and I still got COVID. And my argument is, well, did you end up in the hospital? Were you out of work for a couple of weeks because you were so ill? No, that wasn't the case. And like, well, the vaccine did its job then. Some people regret taking the vaccine simply because when they got it, they didn't feel that great for a day or two thereafter, which in my mind is not that great of an argument because, if I get a throat infection, my doctor is going to give me an antibiotic if it's a bacteria, and I might be nauseous for the next 5 days while I take the antibiotic, but at the long run, I'm still going to get the benefit of not having a throat infection that could get complicated and kill me. So it's usually digging down to why are they regretting it. And a lot of times you can present reliable information that, you're viewing it from this side of the coin, but if you come to this other side, you'll see that this actually was a benefit, that you actually did well with it. And maybe that way you can flip that coin and say, oh, now that you mention it like that, it seems that, yeah, I should have gotten the vaccine anyway. That one patient might be a little bit more tricky to convince to get the booster or the bivalent vaccine that we have now. But again, if you frame it in a way of this is the accurate information, this is the information that we have based on all the millions and millions of doses that we've given, not just in the US, but worldwide. And this is the benefit, not just to you, because, if you want to be selfish, by all means, be selfish and get the vaccine because you don't want to get sick. But the benefit that you give your family, your neighbors, your community, that you're also giving them that protection. I think that when you frame it in that kind of way, it opens people's eyes that, I might feel kind of crappy for a day or two. I might get a little bit of a temperature. I might be a bit achy. But after that, I'm going to be safer and I'm going to make my community safer. So that's the argument I use. And 9 times out of 10 is very convincing to most people. Again, there's always that one person that's not going to budge. So you move on to the next one.
So what specific do you have? Well, do you have any specific factors that people are on why people would regret the vaccine?
Most of the time is because they still got COVID after the vaccination.
Yes.
And again, my argument would be, well, you didn't get sick enough that you require medical attention or ended up in the hospital or died. So the vaccine still did its job, because sometimes, and this is, I think, a messaging issue, and again, misinformation, that people think that the vaccine is to prevent you from getting it. Yes, to a certain degree, the vaccine will help with that. But the main purpose of the vaccine is, and has been for a while now, that even if you get it, you won't get that sick and you hopefully won't die. So when you reframe it in that way, it goes from, oh, the vaccine didn't work, to actually it worked for the intended purpose. It didn't have the extra benefit of, oh, I didn't get it, which it's still there for a significant group of people, but I still got a benefit from the vaccine. It would be like, regretting buying a car because you have to put gas in it. Like, well, yeah, but you can still get from point A to point B and takes less time. You don't have to walk. So you have to reframe it sometimes at the perspective of the patient.
Yeah, so those that still get sick, even with the vaccine, that's just basically, basically if they had the vaccine, it lessens their symptoms then, if they still get sick.
Exactly.
Right? Okay.
Exactly.
Yeah, now going back to those people that are on the offense, now I know some kind of argue that, their immune systems are going to do the trick, so how do you feel about that as well? Like, what's your opinion on that?
I tell that your immune system is a wonderful creation of nature, and it does an excellent job most of the time. But it still needs help every once in a while. And if you can give it the help to do its job more efficiently, why wouldn't you? It would be if I ask a carpenter to build me a table, but don't use a chisel. Doesn't make sense. If you use a chisel, you're gonna get it done much easier, which a lot less effort and frustration. So that's the argument. And some people say, well, this is a nature thing, and if nature intended for me to get vaccines, then that doesn't make sense. My immune system would work with it. My argument against that is, well, people use glasses, and nobody is arguing that glasses are a bad thing. People with heart conditions take medications for their heart, and nobody's complaining about that. When you have your back aches or you have a headache, nobody questions for a second going to the pharmacy and getting a bottle of ibuprofen. And there are a few thousand deaths a year because of ibuprofen alone. So it just goes to show you that you need to put perspective on what you're looking at. Yes, your immune system will help you, but on the off chance that you're one of those patients that the antibodies that you have built from other exposures in the past to other things is not good enough, and you have in the hospital, what then? If you have a reaction that's much more severe compared to someone that's next to you and you end up dying, what happens then? So again, it's about yes, your immune system will do its work, but again, you can make its job much easier. And the other argument is, well, my neighbor is a cancer patient and is on chemotherapy, and her immune system is not that great because of those treatment that she's receiving for her cancer. So am I selfish enough to say, well, I'm young, I'm healthy, I'm not going to get it because even if I get it, I'll be fine. But then my elderly neighbor gets it and she ended up in the hospital, or even worse, perhaps even dying. So again, it's all about perspective, that a lot of things we do for ourselves. And yes, if you're young and healthy and you catch COVID, there's a good likelihood that you'll probably be okay. Is the chance of you getting in the hospital zero? No. Is the chance of you not dying from the zero? No. Is the chances of you transmitting this to someone that you care about and them having a bad outcome? The chance is there. So this is all about decreasing the risk of getting it, getting sick from it, or dying, not just on yourself, but in your community.
So my last question for you then is, do you think over time, like hopefully, the next couple of months, do you think the vaccine hesitancy will go away?
I'm hoping that it gets better. Unfortunately, I'm a little bit of a pessimistic in that particular topic, because throughout the years, we've seen how with other vaccines that have been around for decades, there's still some issues with people not wanting them for a plethora of reasons. Uh, but I do hope that as we move forward and more people get vaccinated, and we demonstrate that they are not only doing what we say they do, that yes, there's a good chance that you won't get it, but if you get it, there's a very, very good chance that you're not going to get that sick or die from it. Not only that, but also that actually we vaccinated millions upon millions of people, and the adverse reactions are minimal, if any. That will give people confidence to say, it works, it's safe, I'm going to get it.
Okay. All right. Terrific. Thank you so much for all of your responses. That completes our interview. Thank you.